Okay, gentlemen, we are live, and thank you for joining me today. I'm Mike Paulus, Town Manager, and I'd like to welcome you to our weekly briefing and thank the team for joining us today. Today we have Chief Halloran, we have Jim Buck, Emergency Management Director, and Michael Pascasilla, the Director of the East Shore Health District. Unfortunately, Fire Chief Seward could not join us today, and I hope that he'll be able to come back next week. But we're here to provide you with information and updates on COVID-19, and we've been doing this every Friday at 1, and we'll continue to provide as much information as we can. And our goal is to be interactive and hope that you'll participate and share with your friends and family, and feel free to monitor and post if you like. But we also have a public comment section or public comment we take and an email that we set up at public-comments@townofnorthbrantfordct.com. And also, of course, you can post on the Facebook page or go through our website at www.townofnorthbrantfordct.com. And we welcome your comments or questions that you may have, and hope that you'll participate and send us a question today as we talk about the numbers, as we always do every week, and also talk about guidance from the health department in the state, and where we are with our plans for reopening various departments and services for the town. There is also, of course, a wealth of information on the health department's website, the state's website. You can monitor our Facebook pages as well. And the state the Department of Health and governor's website has a really wealth of information there. And we've tried to direct people to that, and I know that there are businesses out there that we're working with, and they can find information on DECD's website as well, and other sources. So with that, I'll jump into the numbers. And again, we're very fortunate this week to report that we are holding steady at 83 cases since this pandemic started. So we really had a flattening, really flat line here in terms of numbers. So no new cases, and that's a great trend. I mean, that's the news we're looking for. But we're not out of the woods yet, and we got to hold the line, and that's what we'll be talking about. I think kudos to everybody in the community that's working hard to follow the guidance, wear the mask, wash the hands, social distancing. It's working here for North Branford thus far, and we're happy about and pleased about that, to be able to report no new cases at this point. So again, we're not out of the woods, so we'll have to keep working on that. And that allows us, to monitor the numbers and to say that what we're doing is working, and begin to work on plans for reopening. And with that, again, comes some caution. So probably a good idea to, read up and look at that information. If you happen to be a private business, you're probably well aware of that. Guidance is changing, and obviously we have different phases. And so I think the best person to talk to us about that and report on that is our health director, Michael Pascasilla. So Michael, I welcome you and thank you for being on this weekly briefing. And what can you tell us, what's the latest, I guess is the best way to say it.
Thank you, Mike. Again, Michael Pascasilla, Director of Health for the East Shore District Health Department. And what I want to do today, Mike, is I just want to take a moment just to put the pandemic into perspective and talk about what's happening very briefly in the world, in the United States and Connecticut, and of course locally. A lot of information out there, a lot of misinformation out there, and for folks who are following this, give you a little advice. One, you want to use the Centers for Disease Control website. You would also want to go to the World Health Organization, and of course, Johns Hopkins University has a very nice website that spells out where we are, looks at the trends, and it sticks to the epidemiological data. So worldwide, we're seeing some countries that are At one time, they were doing well, and now they're not doing so well. We're seeing some significant spikes in certain countries. For instance, Brazil is one of those countries that's really not doing so well. But let's bring it home to the United States. Right now, as we speak, in the United States, we have 23 states that have an upward trend. And so what that means is they're seeing more cases increase on a daily basis. We have 8 states that are seeing numbers that are steady, meaning that they're increasing, but not significantly. But we're seeing, on average, more cases over time. And then there's about 18 states that have a downward trend, and Connecticut is one of them. So when we look at the data, where Connecticut was, we have some states that are going through that right now. For instance, Florida. Florida right now is a state that has significant spikes in COVID-19. And where they are, we were about 6 to 8 weeks ago. But right now in Connecticut, we have a sort of a flattening of the curve, but we need to keep this in mind. We're still in the middle of a pandemic, and even though Connecticut is at a downward turn, meaning that we don't have as many cases as we did several months ago or even last month, on average, Connecticut is getting 800 to 1,000 new cases per week. And so what we take from that is we still are in the middle of a pandemic. We're still getting cases throughout the state. Now, locally, as you indicated, Mike, we're at a that curve that we talk about is flat, meaning we're not really seeing a lot of new cases, and that's a good thing. The main reason for that is because as a community, and when I say a community, not just North Branford, but even some of the surrounding communities, we took the advice of social distancing, staying home. We took the precautions. And because of those efforts, we're seeing a nice stabilization. Now, that said, we have to keep in mind that at some point we are expecting, based on the models, and the models are coming from some of the top public health agencies, not just around the country or the state, but around the world, that we're going to have a second spike of some type. We just don't know what that looks like. So for right now, my advice to residents is we're in a good place right now, and we want to stay there. But in order to stay there, we're going to need your help. And there are some things that you have to do. And the obvious is wear your face coverings. They protect you, they protect your family, they protect our community. 2, social distancing is important. We have to maintain strong social distancing. And of course, hand washing. Hand washing is key. You want to wash your hands often. You want to use a hand sanitizer that's at least 60% alcohol, and take those precautions. Lastly, what we're talking about is people's health and how we want to reduce risk. We know we have active COVID-19 infections throughout the state, even within our community, but it's not really being spread right now. And that's a good thing. We want to keep it that way. And so every morning we get up and we make decisions. And every decision we make comes with risk. For instance, when you get up and you jump in your vehicle, the first thing you do is you put your seatbelt on. That reduces risk. And just like jumping in your car and taking those precautions, again, face coverings, social distancing, and hand washing. And as long as we continue to do that, we're going to keep the reduce of infection down, not just in our community, but you're going to protect you and your family. And so with that, Mike, I don't know if you want to have another speak. I know a few other folks are going to be talking, and maybe you have some questions.
Yeah, sure. No, thank you, Mike. That's great. And I think that a lot of people We're looking at the reopening, the phases, and obviously maybe we can go through a little bit, a conversation and review of that as well, because the 17th on Wednesday allowed other businesses and enterprises to open up, and of course, people, I think, inherently understand that it's all about the distancing. And so certain, even outdoors activities in terms of sports and leagues and so forth for municipality, we're working through that. I can tell you that from our side, in terms of opening plans, the rec department was moving and is trying to get those plans in place. We have a new director. So that director is getting up to speed on terms of policies and procedures, and also evaluating, what we do, how we do it, and when we do it. So the most recent information is that the rec department will likely be pushing back their reopening July 6th, just out of abundance of caution, and that is, they just need to be prepared, and they want to have everything set up. And there's modifications that have to take place, and in those, like a fitness center that the rec center has. But there's also outdoor activities that they're trying to adjust and make adjustments and get plans in place to do that. So they're moving forward, but so is the library. The library is on track to open July 1st, and to be open July 1st and 2nd. Then they'll be closed the 3rd, 4th, and 5th for the holiday weekend. And then they'll make adjustments and be back open on Monday, July 6th. And Monday through Friday, they'll be open 10 to 5. Saturday, they'll be open 9 to 12. And again, patrons are going to have to be flexible and understand that the library and the modification or the layout, how we do things safely for them and for employees, is going to look different. But we're still with a goal of trying to safety first, but providing services. And so again, the curbside no contact was great, and that worked well. But now we're ready to open up with libraries, and we've got to do it safely. So I think you can speak to that, Mike, in terms of the phasing, both the indoor and people that have questions about, what are the limits on that? How many can you have? And then, the outdoor, why can't I play, a certain sport? And all of these sports and activities all fall into different risk categories. So maybe you want to take us through that, if you could.
Yes. So good point, Mike. With the different phases, so the state of Connecticut has what we call sector rules. And so you look at the different business sectors and different activities, and they're putting it into different phases. So we went through phase 1, now we're in phase 2. And within phase 2, there are more restrictions that are lifted. However, there are precautions that are put in place. For instance, with restaurants, you can now dine inside a restaurant like you did in the last phase with the same restrictions. You have to wear a face covering, except when you're eating. You still have to social distance. The capacity of restaurants are reduced to about 25%. And right now, there are some restrictions on gatherings. Outdoor is safer than inside. And so because of that, we've put, based on, again, best practices and public health data, that indoor private gatherings are limited to 25. Outdoor gatherings, 100. And then there are some outdoor venues that are opening at 25%. And all this information I'm talking about is on the Department of Public Health's website, and it can give you the specifics for the different sectors. Effective July 3rd, the gatherings do increase a bit. So private gatherings, well, they're still at 25. Outdoor gatherings are at 100. And then there are some events that can take place. It's up to the municipality to decide what cannot happen. Again, we look at risk, we look at where we are, and is there enough space? And then mid-June starts phase 3. Now, with phase 3, looks like it's going to be somewhere around July 15th. And then over the next week or so, you're going to hear the governor release some of the information, and it'll be posted on the website. But as of right now, mid-July, phase 3, private gatherings will increase to 50. Outdoor private gatherings, so it's indoor, this is outdoor private gatherings, up to 250. The thing to keep in mind, just because there's a gathering or an event or something that is open, you have to gauge your own level of comfort. Again, it's about risk. Every time you go out, there's a risk that you could be exposed to a COVID-19 infection. And so, one, you want to protect yourself, and then two, it's about taking personal precautions and trying to protect yourself. And of course, we've said this from the beginning. We're going to continue to say this. Folks who have compromised immune system, people over 65, really want to avoid going to any of these events. And again, take those extra precautions to protect yourself. Again, probably starting next week, you're going to see phase 3 guidelines come out. There's a talk of a phase 4. We'll have to wait and see what the state releases. There's a lot of people working on it, from business, public health, private industry, to come up with these different regulations, because in the end, we're trying to find a balance between keeping people safe, but also not only keeping our economy going, but also we have to get back to some kind of normal. But that normal will be a new kind of normal. And most importantly, we have to follow those precautions. And again, take personal protection. Just because something is allowed, if you don't feel that you want to engage in those activities, you shouldn't. Thanks.
Okay. Thank you, Mike. Yeah, well put. And you're right. The phases and the opening, partial reopenings, and everything that's going on, people getting back to normal. It's interesting to watch. And I know, Chief Halloran, you've been monitoring this from a public safety standpoint. People are getting back out on the roads. People are getting back out and shopping and so forth. And there's it's almost like we've coming out of a hibernation kind of thing, when that's it. People have been staying home, staying safe, and now they're getting out there. And so anything you want to report to us and what you're seeing with respect to the data and public safety?
Yeah, so first of all, happy Father's Day to all those fathers out there. Father's Day weekend coming up. Hopefully everybody will stay safe this weekend. So what we have seen in like you said, Mike, it's kind of like a flower starting to bloom in the springtime. People are getting out there. Traffic has increased tremendously. So with that, what comes with that is traffic crashes. The interesting thing was that during this COVID period that we had, the first, 3 months or so of the COVID, we had our traffic crashes were down approximately 60%. Just the first half of June, we're almost equal to what we were the previous year. Just a couple days ago, actually 2 days ago, we had 4 crashes on Route 80 within a span of like an hour and a half. I don't know if it's because people haven't been driving, or they're just they've been sequestered for so long with self quarantines or what it might be, not working. But getting out there, I noticed that people are traveling fast. There's aggressive driving going out there. I don't know if our tolerance level has gone down during this time period, but we're starting to see that. So keeping in mind that it is Father's Day weekend, let's try to watch how we're driving out there, and hopefully that everybody comes home safe. Because on top of the COVID cases, now we're starting to deal with accidents with injuries. we're starting to see not only we're the small percentage of people that don't always obey the law, we're staying home. They're starting to come out too. We're starting to see a huge increase of theft from motor vehicles. So we're going to get back on the pulpit and ask people to lock their car doors, because they're back out at night. We're starting to focus on those types of things. We have been open during the entire pandemic, and what we did was just recently we reopened up our fingerprinting services again for people that need to get fingerprinted for pistol permits as well as job applications. When you come in, please come in masked. I'd like to reinforce what Mike Pascasilla talked about was this is not over. Please wear your masks, not only to protect yourselves, but to protect us. That's pretty much where things are going, Mike. It's just we're reopening and people just want to get out there. And I just highly encourage people to practice those social distancing rules that we have now, as well as the face covering. It concerns me when I see the increases in the southern states. And as we start to get out and move about, why take the chance? Why put yourself in a bad position?
Yeah, thank you, Chief. And great observations, great data. And the fact of the matter is, as much as we like to encourage people to do their services electronically, there are certain things like fingerprinting that you just have to come in to do. So call ahead, make an appointment, and hopefully I'm sure you're processing as many as you can, and people just be patient about the backlog that I'm sure that exists, and trying to work through that backlog. If people are just patient and again call ahead or try to set an appointment, that'd be great. We recognize, and just like paying taxes and the tax season coming up here for town hall, we're trying to work through our plans, and again, we'll try to make alternative methods available, like paying electronically and doing that. But there are folks that just want to do a in-person transaction, and we understand that. And there are things that have to be done in person, and we understand that. But it's safety first, so we'll continue to wear the mask and do what we can. And I think we're in good shape. We talked a lot about our early weekly briefings about supply, and supply is, I think, somewhat caught up with us. And the one of the point persons, Jim Buck, and I want to bring Jim in on that score in terms of talking about where we are with PPE and so forth. I think we've made the catch up, but we still have to continue to order so that we have supplies through the summer and through the fall. Jim, how are you?
I'm doing well. Yes, and certainly the messaging we want to get out to the town is, that the town hall, as they continue to open up, we are. It is a workplace. It's not just a place for everyone in the town to conduct their business. It's our workplace. We want to make sure everybody stays safe. So you're right, Mike. We've increased our supplies so that they're available for our employees, for their protection, for the protection of those that enter town hall as it reopens, and all town buildings, as you've talked about some of the other town facilities that are opening up. I think it's also important to note out, and you're right, the supply chain's opened up, that things are still restricted. I think Health Director Pascasilla made some excellent points and a good overview. I would like to highlight them a little bit as we talk about people getting together. This is the time of year, and we can certainly recognize the disappointment that's taken place, especially as milestones have come up and people haven't been able to celebrate as they normally would. We're thinking, both, school-age children, seniors, all the events that have had to be canceled or postponed. But it's not just, it's not the time to go all in, let's say. We still need to practice precautions, make sure we're using, the appropriate PPE. Businesses that are open, I hope they continue to utilize the ordering process that's through the CBIA. they can order their supplies. The town is willing, and we certainly have been fulfilling those orders to make sure, through the state distribution, to make sure that they have the thermometers for scanning their employees, the masks that they might need for themselves, so that the businesses can be safe while they open. And we certainly want to keep a lid on this. Director Pascasella mentioned it. We have been quite successful up to now. And that's no small part to the changing behaviors of individuals in the town. The citizens of the town have changed behavior and should be commended for that. And I think it's something we don't want to see go away. We can't say this is in our rearview mirror. It's very much our present situation, our current situation. And I want to reinforce and hope that everybody in town heeds the message, heeds the warnings, and continues to utilize precautions.
Thank you, Jim. Appreciate your comments as always, and your help in being part of the team here. And getting the information out. I mean, we've handed out a lot of thermometers to businesses that have been coming through, masks as well. And I think probably even in the future briefing, we probably have Roger Salway come back, because I think there are another additional opportunities on the economic development front from a business standpoint in terms of processing loans and next round of loans to help businesses get back on their feet and reopen. So thank you for that. I appreciate it. And at this point, I'm just looking through email, and I don't see any messages or emails on our public comments section, and I don't have access to our assistant. And but maybe Jim, I don't know, or Chief, if you've got access to the Facebook to see tell me if there are any posts out there, any questions that people may have sent in. Otherwise, we can wrap this up today. And we can just grab those questions or posts if there are any, and bring those back for the next weekly meeting.
I'm searching right now. Let me take a look.
While Jim's searching, one other thing to mention is we keep hearing about the latest treatments and the vaccine. And here's what we know as of this week, and this came from the Centers for Disease Control, that we have some promising treatments, but right now we really don't have an effective treatment for COVID-19. And with respect to the vaccine, we have a few promising vaccines, but even under the best timelines and scenarios, we're not looking at a vaccine probably until early next year in 2020. So we got a bit of time for treatments and vaccines. Again, very promising. All signs we were going to have them soon, but we got a bit of time to go.
Okay, thank you, Mike. I don't see, I've just been informed, no posts, unless there's something I missed. So you picked up, Jim? No posts?
I didn't see any.
No emails, right?
No.
Okay, so anything else for the briefing today, gentlemen? Otherwise, I think we can wrap up. I mean, I will also plug the food pantry as I do every week, and again, it's and the folks on the front lines. Again, thank you. I stepped over that at the beginning, and thank you for everyone in the food service industry at the supermarkets. Obviously, worked from the start, right from the beginning, getting us what we need. So not always easy to be on the front lines, for sure. So my hat's off to all those individuals, and we'll continue to come back each week Friday at 1 and try to give you an update on what we're doing, what we're hearing, what we know, and share that information with our viewers, and hope to take questions and answer those questions at a later date. So anything else, gentlemen? Otherwise, we can wrap up for today.
I did see one question just come in, Mike.
Okay.
We have a question. When will tax bills be mailed out?
Good question. Those are being prepared right now. We're making the legal notice going in, so those will be out by the end of the month for sure. We're right on track to do that, and we'll be open. I think the plan is to try and open to be able to receive those taxpayers for July 1st if we can get everything that we need to in place by then. Yeah, but they can just certainly send that to that question and give you the date certain to anyone that has any other questions to town manager at townofnorthbrantfordct.com. Be happy to answer any questions you may have. Great, thank you, Jim. I think that'll do it for us today. Appreciate your time and effort as always. Thank you very much.
Okay.
Okay, thank you. Have a good weekend.
Weekend.
Bye.